I have arrived from Yakima, Washington in the Northwest, where I had a robotics program that I developed over 6 years. And it was the result of my training in general surgery in New Orleans at LSU, as well as abdominal hepatobiliary training at University of Washington in Seattle. I was able to learn how to do complex surgery in an open manner prior to working with the robot, which allowed me to do surgery that normally I wouldn't have been able to do through small incisions. And so I developed a program that was unique and really was tailored in a way that nobody else in the country was doing, and that was doing 99% of the hernias that we encountered in a minimally invasive manner, which means doing them through small incisions with a robotic device. And I'm coming to Panama City with the intent of building a robotic general surgery program that focuses on hernia repairs and providing that level of care for the community. So hernias are something that many people think they may have or are suspicious they have based on pains they have or bulges. And a hernia is really characteristic when it bulges out and is something that is normally not there. Usually in the groin area, by the belly button, anywhere up and down the middle of the abdomen, a bulge that normally is not there, that occurs with exertion or heavy lifting, but regresses or goes away when that lifting's over, is something that's very suggestive for a hernia. Hernias can hurt and often do, and so pain as well as swelling or a bulge is pretty characteristic for a hernia. Hernias are repaired whether they are small or large. A small hernia becomes a large hernia, and for that reason, repairing them with mesh and doing them surgically is really the only way to do the hernia repair correctly. It used to be that clinicians would sit on hernias, wait for them to become larger and to become a problem. But now we know hernias will grow, hernias can cause problems when they're small, so we need to fix them when they're easier to fix and have less of a chance of coming back. When you fix a hernia, it's standard to use mesh, which is a plastic screen that we place in the body. The body grows scar tissue into it and reinforces the strength of the repair. It is something that's non-negotiably beneficial and absolutely been shown to be important and indispensable in the repair. Robotics have the benefit of being more precise, providing the surgeon with a much more focused exposure and vision to the surgery. The surgery is not quite different, it's just performed in a different manner. It allows a surgeon who is good at what they do to do it better with better vision and better precision. It does small incision surgery in a much more precise manner than small incision surgery has been over the last 25 years. So the advantage over open surgery is obvious. Smaller incisions, less pain, faster return to work, less complications. But when you compare it with laparoscopic surgery, which is also small incision surgery, the amount of patients or the percentage of patients you can do minimally invasive procedures on is markedly higher in robotic surgery patients, and that is one of the major differences. 100% of people coming in can be considered for a robotic surgery repair, whereas only about 25 to 30% on the national average can be considered in that same frame of reference for a hernia repair, in laparoscopic repair. One of the common misconceptions is that a robot is making the decisions and doing the surgery. The robotic arms are just extensions of the surgeon's actual fingers and hands, and absolutely the surgeon is doing the operation. Robotics is a misnomer in many ways because the robotic arms are controlled completely by an individual next to the patient and has no decision-making capability or anything that allows the arms to work independently. An average operation that is robotically assisted, that's uncomplicated, takes between 45 and 60 minutes. So around 50 minutes. If it happens to have previous surgery involved in terms of scar tissue, it can take a bit longer. The beauty of robotics is that the less difficult surgeries are much easier and hence much safer for the patient, and the more difficult cases are not only easier done, but they're also much safer and actually able to be done. So the robot is a great enabler of a surgeon. It allows them to do the easier cases really easy, and the more difficult cases get done in a minimally invasive manner, whereas other situations would warrant that be an open procedure, which brings more pain and more complication risk. All hernia repairs carry the same lifting restriction. Whether it's done through small incision or large incisions, they have to be allowed to heal. So 4 to 6 weeks is the general guideline for heavy lifting. But when your incisions are small and you have suture placement inside robotically versus some of the mechanisms they use laparoscopically or open, the pain profile over the first 2, 3, and 4 weeks is much less for robotic surgery than the other techniques previously employed. But the end result in terms of when you can get back to heavy lifting and heavy insertion are pretty similar across the board. Robotics is amazing to use from a hernia repair standpoint because it lets us do minimally invasive procedures on many more patients than normally we can do laparoscopically or through open repair. And that is important because 25% is the national average of patients that can undergo a small incision through a laparoscopic technique, which is the standard technique which has been employed for about 25 years. Robotics allows us to treat almost 100% of people who come in our door with any type of hernia with small incisions. And that provides all the benefits of small incision surgery, such as less pain, less complications, and quicker return to work. So it's truly an enabler of the surgeon to provide more care to more patients. I trained at LSU in New Orleans, a charity hospital, and I also had fellowship training in liver and transplant surgery at the University of Washington in Seattle. My private practice in Washington State was one of the first practices in the country to employ robotic surgery across the board in all aspects of general surgery, including hernias and colorectal procedures. I've now come to Panama City to build a practice of the same manner. We're going to try to transform the surgical landscape in Panama City and the Panhandle to allow more patients to get minimally invasive surgery in a surgical technique that is better and creates less complications. And that's my benefit that I can provide the community.